Hello, welcome. We will be introducing a new prenatal breastfeeding class virtually. So, for those of you who are missing your courses, in the same way that I'm missing my earring, that you will be able to get this information that you need, share it with other people who you feel are in need of the information as well, and we will all learn from one another. So, welcome. My name is Kay, and I'm excited to have you here with me. All right, so with the way that the breasts make milk, it's helpful to think of it like a factory. So the more there is demand for a product, then the factory would create a supply that matches with that demand. So the breasts will function in a similar fashion. So the more that a baby feeds and suckles from the breast, the more that the breasts are emptied, the more the different parts on the inside of the breast will respond by creating the milk that will meet that demand. All right, so before we take a deep dive into the anatomy and physiology of breast tissue, we're going to kind of take it a little bit back and talk about how the body actually begins and when the body begins to prepare for milk production. So, this actually happens at a young age. So during puberty is when the body starts to begin to build glandular tissue. So this is all the stuff on the inside of the breast that starts preparing for milk production. So at puberty it starts, and with each menstrual cycle thereafter, the body continues to build glandular tissue to help to sustain milk production later in life. The bulk of these changes and growth with milk making tissue takes place during pregnancy. So during pregnancy, there's going to be a lot of changes on the inside as well as on the outside. So one of the changes that are going to take place is with your areola. So with your breast, you have your nipple, but then on surrounding the nipple is a darker, more pigmented area of skin that is called your areola. So during pregnancy, the areola is going to become larger and darker. And then um, on that areola, you're going to notice that there are pimple-like protrusions. Now, those have been there, your entire life. In some women, they're more pronounced than others. But during pregnancy, they become more noticeable. Those are actually called Montgomery glands, and they secrete like a oil substance that helps keep that area lubricated. And even, once the baby is born, that oil that those glands secrete, they kind of have a similar smell or remind the baby of amniotic fluid. So it helps the baby know where to go to latch. And with the areola becoming darker and larger, that also helps the baby know where to go to receive milk, because when newborns are first here in the world, they kind of have a little bit of hard time seeing. Their sight develops over time. So those areas, that darker part of the areola, is going to allow the baby to know which direction to go into. It's like a target. And then with the areola secreting those oils that have a scent that's similar to the environment that the baby has been in, it also helps the baby know where to go. So with all these changes happening, there's some changes happening on the inside that may cause your breast to grow in size, cup size. Your breast may also be tender to the touch. Sometimes you may not notice these changes taking place. You may not actually feel them taking place, but there should be some visible changes that you notice. So I made a little drawing for you. So here is a breast. We have the nipple, we have the areola part, and then on the areola we have our Montgomery glands. Inside of the breast tissue, you're going to have milk ducts, and then these little circle areas represent the alveoli. So clusters of alveoli, this is where milk is produced inside of your breast. And then the milk travels down the milk ducts and out through tiny openings, or nipple pores. So it's not coming just out of this little spot. There's several little openings where the milk is released out from. So surrounding all of your alveoli, your milk ducts, there's fatty tissue all throughout those little areas. And the fatty tissue is what actually determines the size of the breast, but it does not have any type of bearing on the amount of milk capacity that's able to be produced. So again, breast size is determined by the fatty tissue that's inside of the breast, but it does not determine capacity or ability to produce milk. So small breasts can make just as much milk as larger breasts. From 10 to 14 weeks gestation, your body is already producing colostrum. It's already producing that early breast milk. So a lot of times we hear phrases from people who will say things like, after you give birth to your baby, you have to wait for your milk to come in. Your milk is already here. 10 to 14 weeks gestation, your body has already started producing that early milk. It's just after you deliver your baby, in response to hormonal changes, your body will increase the amount of milk that you are producing and releasing in response to the amount of times that milk is being emptied from your breast. So that includes the baby feeding and emptying the breast, or if you are expressing or pumping your milk in response to that expression. So in response to the emptying of milk, your milk volume will increase, but you have already started producing that early milk at around 10 to 14 weeks gestation. So 2 to 3 days after delivery, or 3 to 5 days, depending on the person and depending on what's going on, there will be a feeling of fullness that will be experienced with the breast tissue, and that's because your milk has increased in volume around that time. So it's very important. The only thing that's going to provide relief for that feeling of fullness is getting the milk out. So feeding the baby on demand, feeding the baby whenever they show signs of hunger. If for whatever reason you're separated from your baby, you want to make sure that you're making use of hand expression or pumping to get that milk, to release that milk out, to give yourself some relief of that feeling of fullness that you're experiencing. So I mentioned that within the first 3 days is when, after the first 3 days after delivery, is when we would expect to see an increase in milk volume. There are situations or different factors that would impact milk increasing in volume and causing a delay, essentially. So some factors that could result in a delay in milk production increasing could be obesity, it could be hypothyroidism, it could be C-section delivery, it could be type 1 diabetes, it could be someone of a older age because hormones may be a little bit different. It could also be retained placental fragments. So if your body still has some placenta, your body still thinks the baby is not born yet. So that could be preventing your hormones from balancing out, which would then allow for your milk to increase in volume. So these are a couple of risk factors that may delay the milk from increasing in volume. So it's very important during this time that if you're experiencing a delay and your milk is not increasing in volume, that you're working very closely with your physician, that you're working very closely with the hospital staff and the lactation consultant to ensure that you and baby are being taken care of during that time until we can get your milk supply, your milk volume where it should be.